The NHS spends more than 8 billion on wound care every year. 3.8 million patients live with chronic wounds, many of them not healing, a huge expense to the NHS. And it's an enormous amount of activity, so 50% of what community nurses do. And why we have a problem is there's simply no visibility of wound care and significant variations in care, and the problem is only increasing. Minuteful for Wound is a CE-certified AI-powered digital wound management solution comprising of an app and a central portal. And what it enables clinicians to do is capture a video scan of the wound, and our AI is able to calculate the area of the wound, tissue types within the wound bed, and also enables the clinician to capture a best practice assessment of the wound according to the wound type. And all of this rich clinical information is sent through to that centralized portal for senior and specialist nurses to be able to offer treatment optimization advice and guidance. Some of the impact that we've made. So through that virtual caseload review in the portal, 66% reduction in senior nurses having to go and see the patient to review them, and actually being able to review them virtually instead. Significant savings in being able to view and optimize those patients onto more affordable treatment pathways, and actually optimal treatment pathways. We've been able to provide a robust oversight of formulary use, reducing antimicrobial dressing uses, which are hugely expensive dressings, by 33%. And from a quality perspective, been able to help our customers reduce serious incidents related to wound care by 64% in the same team pre-Minuteful for Wound and post-Minuteful for Wound. And how we're able to do that, so using a real patient case study from one of our clients, a 94-year-old gentleman who came onto the caseload with a lower limb ulceration, was visited by the community nurses weekly, but not assessed or put into the right compression therapy for his wound. So the wound deteriorated, and that just meant that the nurses went and said, okay, we must visit them more often. So started to visit the patient more often. And again, not the right assessment and not the right therapy. And this went on for 16 months for this patient. And then Minuteful for Wound was onboarded to this team in April, and there were enough assessments that were put into the solution to be able to have the AI flag that wound as deteriorating. And the TVN team, doing regular reviews of those deteriorating patients, were able to optimize that patient and put the patient into optimal compression, and the patient healed 2 weeks later. And the cost difference for that 16 months is over £3,000 for the whole 16 months, compared to if that patient had been able to be optimised more quickly as soon as they came on the caseload. You can see the impact that can be made. So that early detection, that early deterioration status, that ability for the TVNs to have full oversight of the whole caseload really impacts wound care. And we think that this is something that can be applied across different settings within an integrated care system. Thank you.